Here in the United States, there is new guidance tonight for women and mammograms. The American Cancer Society now says women should start getting mammograms at age 45. That's 5 years later than the previous recommendation. An estimated 12% of all U.S. women will get breast cancer. Lisa Starks in Washington with more on the new recommendation. Lisa.
Well, John, there is disagreement over when women should start getting mammograms. As you said, for years, the recommendation was start at age 40. Then a few years ago, a task force actually said, no, it should be 50. Now the American Cancer Society is saying age 45. So this could create a lot of confusion for women as they try to figure out what is best for their health. For millions of women, it's an annual routine, a mammogram to screen for breast cancer. For years, the American Cancer Society has recommended screening start at age 40, but now new guidelines.
We know that debates are going to continue about the age to start mammography. This guideline makes it so clear that by age 45, all women should begin screening. That's really where the benefits substantially outweigh the harms.
Those potential harms are false positives, where something suspicious turns out to be nothing, but leads to extra tests and treatment and anxiety for women.
Personally, I feel like I would rather have a lifetime of false positives than catch the disease at a much later stage, and I'm pretty sure my family would agree with that too.
Breast cancer survivor Kara Gorski has a family history of the disease, so the new guidelines would not apply to her. They're only for women who are healthy and have an average risk of breast cancer. But she says the problem is many women don't even know they're at high risk, so she believes earlier screening is critical.
And so it's confusing to know what doctors should do, and I think as a patient it's even more confusing when you walk into a doctor's office. And I think there's also the uncertainty with regard to insurance companies, whether they will be covering mammograms given at an earlier age or not.
In addition to raising the age for initial screening, the Cancer Society calls for annual exams only until age 54. After that, it's every 2 years. And they say there's no need for regular breast exams by your doctor. Dr. Charlotte Dillis specializes in breast imaging at MedStar Georgetown University Hospital. She worries about the impact of all the different advice and recommendations.
That is the biggest problem, I think, is that women are just going to throw up their hands and say, no, nobody knows what to do and just forget about it altogether. And that's what we really don't want to have happening.
There's little disagreement on one thing. Under certain circumstances, mammograms can help save lives. Lisa. Now, to try to find some common ground, the American College of Obstetricians and Gynecologists is planning to hold a big conference in January. The American Cancer Society will be there. Other groups will be there. John, the hope is they can come to some consensus agreement, more clear guidelines for women on when they should truly begin these mammograms and how often to have them.
Lisa, thanks very much. Breast cancer survival rates have been steadily improving.